I'm Karen Ashforth. I'm an occupational therapist and lymphedema therapist. Many of the patients that I treat in my clinical practice are women, and sometimes men, who have lymphedema symptoms as a result of breast cancer. I'd like to talk about the types of treatments I use in my clinic for these patients. These techniques can also apply to the treatment of other types of lymphedema as well. For those of you watching who have lymphedema, I strongly urge you to consult with your treating physician and your lymphedema therapist if you want to follow up with any of the material presented today. Every person is unique, and these treatments are intended to be individualized depending upon each patient's distinctive presentation of symptoms. In many cases, lymphedema is a noticeable side effect of breast cancer treatment that persists after surgery or can develop with radiation therapy. Lymphedema can be chronic and progressive. Many people seek help right away, but lymphedema can happen even decades after tissue damage. Sometimes there can be what I'd call a slow leak, where lymph circulation doesn't quite keep up, creating a small backlog of congestion that can develop gradually over time. The primary goals of lymphedema treatment are to reduce the swelling and compress the affected area to promote increased lymphatic circulation. Lymphedema treatment usually starts with manual lymphatic drainage, a specific form of massage designed to direct lymph fluid towards the lymph nodes. It is gentle and relaxing, but many patients are not able to perform it themselves. Many are limited by pain, weakness, endurance, or limited ability to reach. It can get expensive to pay for this massage, and although many insurances will pay for basic treatment where it is instructed, ongoing massage is not generally a covered benefit. Pneumatic compression is not only effective for reducing swelling, it is also very helpful for treating fibrosis or hardened tissue. When swelling persists, the tissues can actually start to change in composition. I compare it to making Jell-O. If you let it set long enough, it turns from a liquid into a semi-solid. When fibrosis forms, it can slow down and even disrupt lymphatic circulation. There are some conditions in which pneumatic compression therapy may not be appropriate. Contraindications are known or suspected deep vein thrombosis or pulmonary embolism, during the inflammatory phlebitis process, acute infection of the affected limb, decompensated cardiac failure, severe arteriosclerosis or other ischemic vascular disease, or any circumstance where increased venous and lymphatic return is undesirable. Due to the movement of fluids in the body when using the device, it is important to exercise caution with patients who have heart disease. And high pressures are not recommended for patients who have peripheral occlusion disease. And finally, the abdominal area should not be treated during pregnancy. It is also important to note that the LymphoPress pneumatic compression systems are only available with a doctor's prescription. This is a pneumatic compression therapy system called the LymphoPress Optimal. I use this system extensively in my clinic. I like the Optimal because it has lots of options for customization, including a wide range of compression settings. The appliance or garment that I prefer to use for patients with post-mastectomy lymphedema is the LymphoPress ComfySleeve, and it is quite a bit different from other pneumatic compression appliances you may be familiar with. It's like a ski jacket with one arm sleeve, and it treats the shoulder, chest, back, abdomen, as well as the arm. Here's what it looks like inside. There is an inner layer you can't see that contains air chambers that inflate and deflate in sequence to apply the compression and massage. This is an inflating chamber that presses against the axilla and does a very effective job of decongesting it. What I like about this garment is that it's designed so patients can use it independently, without assistance. It goes on much like a regular jacket. There is a zipper that can be opened at the treated arm so both hands can be used to fasten the garment around the body. The fastener goes around the body. The tabs are closed at the top and bottom. Now the patient can let go and use both hands to zip it closed. Now the patient pulls the side straps so it is comfortable but not tight. She can use either hand. A slightly loose fit will give a better massage effect in this garment. Closing it too tightly may prevent the air chambers inside the garment from inflating completely. Now the patient zips up the arm zipper and she's ready to begin treatment. I prefer to treat patients in clinic with them lying down, but at home you can sit up in a comfortable chair with the arms supported. With the arm extended, the axilla chamber I showed you before can fill up and press to decongest the armpit area. If she lowers her arm, the compression in the armpit will be less, so we change the treatment effect by changing the arm position. I have set the pressure for 45 millimeters of mercury. This refers to the maximum amount of pressure at the hand. The pressure gradually decreases in a gradient as it approaches the abdomen. I like the fact that the Optimal provides a wide range of compression for my patients. I can adjust pressures easily, and I can use higher or lower settings overall, or in certain areas, particularly if there is sensitive skin or pain. Some of my patients have fibrosis. In those cases, I may use higher pressure to give a softening effect. The LymphaPress Optimal has several choices of massage modes. There is a pre-therapy mode that decongests the torso before starting the treatment. It is followed by a choice of two treatment modes, sequential and peristaltic. I use the peristaltic mode most commonly with the ComfySleeve appliance. It is a comfortable mode that feels very wave-like. It is appropriate for the treatment of all stages of lymphedema. The sequential mode is most useful for patients who have hardened tissues, but I've observed in my clinical practice that overall my upper extremity patients prefer the peristaltic mode and can tolerate higher pressure with the peristaltic than with the sequential mode. I use pre-therapy in combination with both of these modes, as I would clear the torso in manual lymphatic drainage. Treatment time is generally 1 or 2 sessions of 60 minutes per day. Patients are able to adjust the time if they are short of time or want a longer treatment. The treatment starts with pre-therapy, working over the abdomen, then progressing to decongest the chest, back, and shoulder. The patient can read or watch television during treatment. My patients tell me that the massage action is very soothing, and many of them go into deep relaxation and even fall asleep during this treatment. Now, the peristaltic mode starts, moving up from the hand, decongesting the arm, the chest, and down to the abdomen. I've really enjoyed sharing this information with you, and I hope this treatment method will be an effective tool for you to use with your lymphedema patients. Thank you for your interest and attention.